folks. Welcome back to the iHealth channel, iHealth Radio, with your host, Hurricane H. New day, new show. Awesome topic as always. We're trying to get the best of the best expertise out here for you guys. And with me today, I have a guest who's going to take us to a discussion in healthcare that we probably need more of, and that is about basically our burnout in a way, whether in person or in the healthcare, space. But in general, she's a palliative care pediatrician, a pediatric oncologist, and a CEO of Recharge Studio, an author, and really she's a coach and helps a lot of people do better. And so with me today, I have Dr. Emma Jones. Doctor, welcome to the show.
Nice to be here. Thank you for having me.
Well, listen, hey, thank you for being here. And really, this is cool because we've covered oncology, we've covered, burnout and different topics and different angles, right? But again, it is something that we need to discuss more and more of. But before we get into that, I mean, that's a lot of hats you're wearing there. So let's talk about. I always start with your journey. I mean, it is. I mean, I know you're a doctor, and everybody's like, well, she's a doctor, but every doctor has a different journey and what got them into what they do and their mission and how they feel about it. I mean, if you could just get our audiences a little bit, closer to you, and because you've also done more work now with the coaching and stuff, and how that all plays in parallel to your, I guess, regular career.
Yeah, it's I'll try to keep it concise. This story is a long and winding road, as I'm sure many people's is, in how we find our way to the things that we do. I am a doctor. I'm trained in the traditional medical MD pathway, undergrad, med school, residency, fellowship, and then you get your real job, which we call attending. So I went through all of those steps and trained as a pediatric oncologist, as you mentioned. I loved kids. I loved working with families. I loved being with people across the lifespan, from when they were a baby to when they got older. But I also wanted to take care of people when they were sick, so that I was able to kind of do both of those things. I eventually did get into palliative care as well, which palliative care is specifically for people who may have shortened lives or whose lives are impaired significantly by the conditions. Now, certainly almost any child who has cancer would fall into that category as well, but it's a sort of cherry on top of the intensity that comes with the work. And it's also not just for cancer patients. It's for patients with any kind of condition who may have an impaired quality of life or a shortened life due to their condition. So that's been a very rewarding career. I've sort of evolved into doing that now for all ages. So I really do the whole lifespan from 0 to my oldest patient recently died at 106 years. So all the way, I didn't take care of her whole life, obviously. So that's really fun and a really privileged part of my life to get to companion people during these points. But something I've become interested in recently, as you mentioned, is the burnout coaching through my work in major hospitals, community hospitals, clinics, kind of everywhere that I went. It just was so clear that the whole system was under so much strain. The clinicians were unhappy, the patients were unhappy. It's like nothing's working. So I have really picked up a new mission to do my part to kind of overhaul this U.S. healthcare system by helping heal some of the people who work within it. So I now do coaching work with physicians and nurses and other healthcare professionals to help them get out of burnout so that they can enjoy their work again. Because everybody wants to know, like, go see a doctor who actually likes being a doctor, right? You don't want to go see somebody who's like cranky and wishes they weren't actually there.
Well, thank you, doctor. I mean, there's a lot there, so I want to just deep dive in there. Well, the first thing is first, I mean, I have to just, I want to thank you, I mean, for the work you do, because it's not for the faint of heart. I mean, it is, you picked one of the, probably the most difficult, I guess, specialties in medicine, because oncology, and you add that children, and I mean, that's just, we understand cancer.
Contest, but I hear what you're saying.
You know what I mean? Yeah, it's a tough place, right? And but here's the question. I mean, kids. I mean, cancer is something that's becoming more and more, I don't know, part of this society. I don't know how it happened. I mean, I do know how it happened. I mean, that's why we have these channels to discuss some of the things to maybe mitigate, and prevent, these getting into a
Sure.
cancer, situation. But certainly there's a lot of factors that are impacting our, I guess, culture world today, where it's nutrition, it's the environment, everything else that's happening is really affecting how the body works. And there's more to it. I mean, some of it may be genetics, but at the end of the day, I've had various shows, discussions, and so on and so forth. And there are ways to prevent these things, and hopefully, but the question is, in your expertise, how? I mean, I get it. I mean, it happens to everyone, but kids typically, they have a healthier immune system. They're still, developing. How does that even affect, children and more today than, is there in your studies, or at least work, some sort of a trend that you see that is alarming, that is more than, I mean, it's something that is just different today that maybe like 34 years or 40 years ago. I mean,
Uh, Not really. I would
oh,
say, first of
okay.
all, I'd just be reassuring that I do not think that pediatric cancer is on the rise. Many
Well,
lifestyle related cancers that adults get, they're related to lifestyle. So as we have lifestyle and diet, things like colon cancer are gonna become more
mm,
common, but for the pediatric cancers, I don't think we're actually seeing an increase. The media, we have so much more exposure to every case. It sometimes can feel like it's more, but there's really not any significant increase. One thing that is affecting cancer rates all across the board is if now you're surviving something that you would have died at an earlier age, now you're like living long enough to get the cancer. So this is happening with adult patients too, right? As we got better at taking care of heart disease, more people lived into their 80s and they lived long enough to develop cancers. So of course, these overall rate increased, but not because of some special cause variation, just because that's how things work. So that is true in pediatrics. If there are particularly preterm infants who may not have survived infancy and now are surviving, they may have slightly increased risk of certain types of cancers. So if more of them are surviving, we may see more of those cancers, but again, incredibly rare and nothing that's significant. I think it's really just this exposure bias, that we're hearing about it so much. You see the St. Jude commercials and you
yeah,
see
yeah.
everybody on Facebook and it feels like, oh my gosh, everybody's got cancer. It's not really like that. We still have to um, consolidate cancer care for children into very specialized hospitals, of which there are very few in the country. So that right there tells you this is not a common condition that's like on every street corner. So
Well,
that's
thank
good
you.
news.
Well, that's great news, as a matter of fact. And the reason I ask is because, as you said, we see it all the place. I mean, there's not a day that if you're watching TV that you're not going to see a commercial for St. Jude or some other charitable, idea of supporting, oncology and
That's right.
pediatrics, right? So therefore, it becomes like almost in your face, and so you do have, I mean, the impression that it's just happening more and more. So thank you for giving us the reassurance. At least now we know that it's it's not a relief. I mean, there are still people with it, and therefore parents are dealing with it, and the children. But as you said, it's not an alarming increase or just a spike in something that hasn't happened.
No.
And I like what you said, the idea that the life that we have today with the technology, with the other types of cures and things, we are expanding a little bit, on our health, and therefore you get to a point where your body develops, as you said, these things, and it is part of, I mean, I think I had a specialist, talking about immune system, and he said that in your lifetime you might develop some cancerous, cells at least 7 times, if you live to the 90th point, right? And some can turn into ugly, and some can just, the body
That's
takes
right.
care of. So just to confirm?
Yeah, I mean, it's pretty remarkable, actually. I don't want to alarm anybody, but basically the way a cancer forms is like when a cell's replicating, it makes a mistake. And then it becomes a cell that doesn't turn itself off, right? Most of the cells in our body make new ones when we need new ones. And then when we've got enough of them, they say, stop, we got enough of those, turn that off. When a cell doesn't have that stop signal anymore, it just grows and grows and grows and grows and grows. And that's basically what cancer is. So every time your DNA is replicating, it could make a mistake. And thankfully, miraculously, I mean, it's science, it's not a miracle, but we have these really good kind of checks and balances in place so that that doesn't happen. But if you just think about odds, right, the more times a cell has to replicate, the more times it could make a mistake. And so if you live long enough, your cells have replicated long enough. Now, the other thing is that not all cancers are created equal. You know, that we say a cancer could be like a little thing on your skin that's fairly benign and it gets cut off and it goes away and you never need any further treatment. That was a cancer. Or it could be, you know, some bone problem that's like throughout your whole body, or a brain tumor, or some like really severe thing. So there's also not just one cancer, right? It's a very wide spectrum of diseases, from really, really mundane type of things. I mean, not that they don't need treatment, but they certainly weren't life threatening, all the way up to, of course, things that people die from. And so it that level of nuance is also missing in a lot of our media discourse. You know, people just say cancer, and there's no additional discussion about, well, what kind and what happened. You know, all the details.
Well, I mean, the C word is kind of like, taboo. I mean, no one wants to hear about it. I mean, listen, I for myself, I mean, I've experienced it through in my family, so I know. I mean, my dad passed, with the prostate cancer that metastasized, and eventually it was too late. And we discovered it, literally 7 months before the end. I mean, in the case that would be palliative care, and I guess hospice, right? So
Yes.
we got to the point that said he was living a life, nothing, never went to a doctor. Well, maybe a couple of times in his life, it was one of those. And until he got to a point, and one day he just literally fell. I mean, he couldn't stand, and
Mm-hmm.
discovered is already like all over the place, and obviously it got into his spine, and that was it. And he can walk anymore. But then the doctor says, no need for surgery. You're just gonna make it worse for him. Let him live the rest of his life until time's up, and that's exactly what happened. And yeah, it is what it is. So it is. I mean, as you said, it can happen to anyone. It could be a lot of things, and then you're right. It's not just one. There's more to it, and there's treatments. Obviously, we have. I mean, we can talk about a little bit about the treatments and
Yeah.
the cost and the accessibility and all the stuff, and at least in the States, and maybe even we can compare it to other places. I mean, obviously, if you don't mind, we can touch on that just briefly, because I mean, I know we have other things that we want to cover, but just since we have you, I mean, you're the expert, and because again, as you mentioned about the social media, there's a lot of asking, especially for kids, for donations and stuff like that. That only includes the idea that it's very expensive to cure, or it's very expensive to take care of, right? And so let's briefly talk about maybe the types of cancers, like, and like, well, I mean, you said
Sure.
if there's a lot of them, but like some of the most common, especially in children, and because I think you mentioned colon cancer, that's a known one. You talked about skin, maybe melanoma is one of
Mhm.
the more, I think that's what it is, the biggest one in skin,
Yes.
right? And but let's talk about, like, maybe in the kids we hear leukemia and bone marrow transplantation and all the stuff. So
Sure.
if you can bring the audience a little bit about what it does, how it works, and what are the benefits, and maybe the I guess the success rate in that, because I hear there's great statistics on that.
Yes, we do have wonderful, successful treatments for our most common cancer is leukemia, ALL, or acute lymphoblastic leukemia. Um, that is also still very rare. It's the most common pediatric cancer, but still very, very rare. Most children are not going to get that. That has, you know, depending on risk strata, there's like some complexity about how we would say, but there are certain risk groups that have up to 97% cure rate. So that's amazing, right? The downside is the treatment is really challenging. It's a 3-year process of pretty gnarly chemotherapy that these kids have to go through. And so the good news is that if you go through all of that, you're going to be cured of your cancer and go on to live a much normal life. The bad news is it's a pretty bad 3 years. So I think this is part of why we have such robust support systems around pediatric cancer. We know these kids themselves have to get through something really hard. The families often have to devote their entire energy towards supporting that child. Maybe one or both parents have to stop working. They may have to move to the place where the cancer center is. So this is really a lot to get through, and why these systems have been created for, around patients and families in pediatric cancer centers. Very necessary. The story that you shared about your dad made me think about another element, and I'm very sorry to hear that you lost him. I'm sure that was hard, but I think that hearing that choices were offered always makes me happy. Whenever we say, "Oh, you have this diagnosis and you have to have this treatment," that's often the way that it's pitched. And what we try to offer in palliative care is not that we want you to choose the no treatment or we want you to choose the comfort care option. We just want you to know that that's an option. And then you can make a more informed decision, because we do see patients all the time who maybe just got worse from the treatment. The treatment really didn't help them, just made them sick. I see from these kids how toxic the chemotherapy is. And the only reason why it's palatable is because we know that we got 97 chance of living a normal life on the other end of this. If I didn't have any assurance that you were even going to survive the treatment, or I thought pretty sure you were going to die in the middle of the treatment, I don't know that I would want to say we should do that, right? Or at least we should offer it as an option for you and your family to consider whether that's how you really want to proceed. And I think that's a space where we have more room in the American healthcare system to kind of interject that choice earlier, not just for cancer, but for all kinds of conditions that may have intensive treatment programs. We have a very much do treatment, more scans, more surgery, more medicine kind of mindset. That's good. And then if you do less, that's bad. And that's not necessarily true. That's just kind of culturally what has been accepted in US healthcare. And then I think we have this whole group of people who's swinging to the real counterculture and saying, well, everything that doctors do is bad. And so we just need to reject everything. And that's also its own kind of problem, right?
I was going to ask you, like, how do you see the other side, the naturopathic and holistic, approach, and I guess Eastern medicine? Because a lot of people, may choose that path as natural, and I've had actually discussions about that, which sometimes it works too. I mean, they both coexist. Is there a way to marry them? Maybe are you one of the I guess the people that kind of promote the idea that maybe we can have both? I mean, it sounds like, you give people choices, but is that a choice as well? I mean, besides just live your life until, it's time, or live your life, but you can try other options. I mean, are you a fan of that, or what's
Yeah,
your take?
I think that it depends really, and
Mm.
that the care plan needs to be as individualized as you are, and that I have medical knowledge and I have skill in assessing your goals and your values. And my job as a palliative care provider is to marry those two. What I and the other specialists know about the science and the medicine, and then what you as an individual or as a family system know about yourself. You are an expert in yourself. I'm not an expert in you. So I got to kind of figure those two things out and then make a medical recommendation. I do think that as doctors, we owe it to our patients to make a recommendation and own that recommendation as a responsibility, versus just saying like, well, what do you want to do? That's not really how to practice medicine, right? But shared decision making, right? Where what I'm recommending is based on what your goals are. What I know the treatment plan will take you closer to your goal. If your goal is to get back to Puerto Rico and, spend one more weekend with your grandmother who lives there, and that if you just get one weekend you're happy, that's going to be a really different care plan than, I don't care if I die in the operating room, give me every chance, like, go for it, right? Those are two really different value systems that are going to guide the decision making. And so I think even when we think about non-traditional systems, which, I mean, everything was non-traditional until it wasn't. So again, one of the value systems that I really assess for is how much is the science and the evidence important to you. And I try to encourage people to like make sense with themselves. If they tell me science and evidence and doctor's expertise is really important, but I want to do this like completely magic thing, I'm going to point out to them that they're a little bit inconsistent with what they're doing. But if someone says to me like, I don't believe in truth, and I don't think doctors exist. And, I just want to decide, like, they have this very magical worldview, then their decisions are going to make sense with themselves if they choose not to go with the kind of more traditional path. And then sometimes there's sort of tough consequences. And this is one of the drivers of burnout in healthcare, is when people make those kind of off the, let's just say, let's call them alternative choices. They make alternative choices, but then if the outcome isn't the way that they want, they sometimes blame the traditional medical system, unfortunately. And so I think if you don't have good skills in place to separate yourself from the work, right? If you can't say, I offered the best that I had, they chose not to take it, and that is what it is, then doctors feel very responsible for that, feel very shameful that they couldn't help that patient, feel very personally responsible that that patient chose a different path. And that causes a lot of moral injury, which leads to burnout.
We're going to touch on burnout shortly, but a couple of things you mentioned there. One is the idea of chemo and treatment, and yes, there is a 97% chance of really coming out, I guess, as a survivor and then a positive outcome,
Yep.
as opposed to 3%. Those are good odds compared. When you think about numbers, right? But the
Really good
treatment.
odds.
Oh yeah, 97% is pretty high right there. Obviously we want 100%, but obviously it's a hit and miss. There's many factors that can impact someone. But what do you say to people that claim, or at least there's a lot of talk out there that people don't die out of the cancer itself; they die out of the effect of actually the treatment. As you said, it could affect your body in a very negative way, and therefore that would be that 3% that maybe not surviving because the body is just not. It kind of hits the other organs and the other cells in the body, so it kind of have it's like a dual. It's a double sword, right? That
Yes.
double-edged sword. You're lucky. You can 97%. You may not get cut the other way, but then if you get the other cut, it's over, right? And by the way, I can again another example, and you'll be like, what's wrong with you, dude? Well, my ex-wife actually died of breast cancer. Not
Mm-hmm.
because the treatment didn't go well with her. So she is one of those
Yeah.
people that the treatment really destroyed her, and she was relapsing, and at the end, just the body gave up, and so I can see that, but there are a lot of people that say, like, what. Maybe don't go chemo, don't go radiation therapy, because those are like very extreme, and they are being promoted, in a way. Because there's also skeptics out there. There's talks about their negative press that says that there's pharma that pays, and there's
Yes.
there's commissions on that. And again, I don't want to go controversial on this one, but you're in the mix of this because you're facing it day in day out, and yeah, and you kind of discuss these things because there's a cost to the work you do, and parents have to come up with these things, and so sometimes. Do I go this way? Do I not go this way? Is it going to be and stuff? When you hear somebody tells you like, oh, well, she's going to get paid in commission, if she gives you more chemo, that would probably deter me from making the decision, right? And anyone that's listening, are like, really, that's happening? Well, we've heard that. Is there a truth to
That's
it? And
right.
so there is.
Yeah, I think, just to first speak to the reality that there is such a thing as toxic death. There are people who die from a complication of the chemotherapy, and that's incredibly sad, especially if the cancer they had a high chance of cure. Many times, those are patients that had equivocal chance of cure and may not have been good candidates for the treatment at all. Anyway, again, maybe that's somebody we should have caught upstream and said maybe we shouldn't start this. But as the case you mentioned, a young woman with breast cancer, of course you're going to try to treat that and make it go away. That would be the default plan in most cases. Sometimes unfortunate things do happen. That's one of the challenges of being a doctor, is that we don't get to control the outcomes. We can do everything right. We can do the treatment plan perfectly. There are no mistakes made, and yet the outcome is still not what we wish it was. So that's one of the reasons why our decision making is hard. We have to hold that reality that even if we do everything right, sometimes things don't go well. The other thing is that we are human beings, and sometimes we don't do everything right. And we try to build systems so that those mistakes don't become egregious. But every now and then you make a calculation error, or your brain just goes out to lunch for a moment and you prescribe the wrong antibiotic, or whatever it is. We're human beings, and mistakes are made. And so that also knowing that another human being may have suffered a negative consequence because of your action is very hard to hold. And then all this complexity that you talk about where there aren't right answers, right? We don't know. There's no way that any human brain could know the answers to these questions that you're asking, right? For you specifically, you 1 out of 8 million people in your cancer, is it going to be better to treat it or to not treat it? How could I possibly know the answer to that question? Too many variables, right? So we use what we can. We talk about, we manage what we can. But it's incredibly hard to hold all of that complexity and feel like we're making good decisions, feel like we're practicing good medicine. And as the data's getting there's just more, right? There's just more stuff to know. There's more labs, there's more scans, there's more types of cancer, there's more genetics. Every year, there's just more. So even just keeping track of it all gets to be a little bit impossible. And then I think as our brains are getting fried by all that more, like wading through the complexity of this decision making becomes almost impossible because it is like such a high executive function. You really need your neurons working tip top. And our brains are underslept, underfed, underexercised, overworked, overstressed. These are not like great brains. It's really scary to say, right? Like your doctor's brain may not be working great. We're very high functioning people. We hide it well, but that the truth is the complexity of medicine and the resource level of most people working in medicine is no longer matched.
Well, thank you. I mean, you're being honest about it, and that's the reality of where we are, right? I mean, we do have a very challenged healthcare system, as you said, and we haven't figured out yet. I mean, I think the day we figure out would be cool, and life will be a lot simpler for everyone. But it is a difficult one. There's legislation on one side, there is lobbying on one, and there's other entities that are industries that are involved in it. There's personal interest, profitability. There's all kind of stuff that gets in there, and then there's the core, which is here's the health problem, and we got to solve it. And there's you as the human factor in between dealing with all this. Of course, there's ethics. I mean, you do have a note that you take as a doctor to save lives and do the right thing. But again, we've seen cases on both sides. Some real top doctors that they fight for the right things and they do the right things, and we have ones that go with the flow and go in the system and they just follow the instructions as is.
Yeah.
My hospital says do this, I'm gonna do what the hospital. Listen, I'm in the insurance space. That's actually where I spent my last 30 years. But all along, I've been working with hospitals and in hospitals because we are. Every plan I worked for pretty much, was owned by a hospital or system or multiples, right?
Yeah.
So we always dealing with them with providers, and I mean, so I hear these things, and it's pretty scary because how it all works, because it's all, I mean, all these systems have to run financially, and so when the cost becomes a factor, then a lot of things become priorities, and sometimes not always on the benefit of the doctors that are providing the care, and therefore you're not going to get the best of the best. Now I support the mission, the work that you do, because we need doctors. I mean, listen, when my mom gets sick and she's an elderly person, yeah, these guys take care of her while she needs. I mean, she has a great doctor that takes care of her. I mean, he really knows her well and has been maintaining her well. I mean, for years. So I appreciate that work, and I've also I want to thank like, I mean, you go to the hospital system, nurses, I mean, are doing a terrific job working aside with the doctors. Sometimes they do a lot more just because they're the ones who are doing all the work, right? And I'm not taking away from the doctors, but you know what I mean.
Oh
Like,
no, we're a team. Don't worry. You're not
all
you're
right.
not hurting me my feelings.
Well, you know what I'm saying. I mean, but it is, so there's there's a human factor, there's a financial factor, those stuff, and there's a system that needs a lot of pieces to be worked on, and we're not going to solve that today, and unfortunately, but
Not
you are
today.
doing, you're doing a piece of it that can help, which is now transiting us to the idea of how do we make this system resilient, and how do we kind of solve the problem where you as the provider and the provider community not being in the burnout. And you've said it. I mean, I think you get burned out no matter what. I mean, first of all, just your education system, I think it's a burning, concept. I mean, all these years that you have to do it and all the stuff that you have to cram and all the stuff that you got to go through in the initial stages. I mean, that's already burning. I mean, by the time you
Yes.
finish, you're already like, oof. And then you have these loans, and I don't, I'm not gonna judge financially who's what, but I mean, it's not cheap to go to med school, at least not in the States, and especially when you go to the next level and then you start your own business and so on. I mean, it is the difficult, path that you choose, but for the right reasons. Ultimately, is to help people save lives, and in your case, even those that you can't, you give them the rite of passage the right way at the end and their life. So that's a good feeling. At least you do the best. Like, listen, with my dad, that was it. I mean, when the doctor was very honest, he
Yeah.
said, "Listen, do you want him to suffer for the next, few months that he has left, and we don't know how that is, or do you want him to live, until time's up?" And it was a very I love that advice, and to be honest with you, I live with that advice, and I have no regrets of the decision we made to keep him alive until it was time. And I do believe that that's the case. Even like all these scenarios, the 3%, the people that go, I mean, at the end, we're all going to expire. I mean, that's the term we use in medicine, right? We're all going to go.
Well, I say die. I
Well,
believe
all
that we
right.
should talk about what we're talking about.
Well, so that's funny that you said that, because I hear the word expiration a lot in the hospital system when the insurance, this person expired, this stuff like that. I mean, we sometimes we lose that human factor, and I love what you said. I mean, dying is part of life, and so we live with that. I
Hmm.
mean, the only certain thing in life is death, and we should call it for what it is. But you're right. I mean, it's kind of sad. Like, you hear that, like, this is not a freaking product. I mean, this is a human being that's alive, that has family and
That's
emotions.
right.
And sometimes I've heard that actually in clinical settings where people kind of talk about it. I mean, even listen, I say this in shows. My dad was literally dead in a room when we had to go, say our goodbyes to him when they
Yeah.
called us. And these guys were laughing outside. I mean, it's like just another body in there. I mean, I guess they get numb to it, but give a little. I mean, just an advice. I mean, folks, if you're in the healthcare system, I mean, you gotta do a little bit more, because that is sensitive stuff. I mean, don't just make it like it's nothing going on. I mean, it's just another corpse. But I get it. I mean, you're used to it, but so that's it. I'm not taking a pet beef here, but really, it's that kind of thing. So thank you for actually bringing that human piece to it, and call it for what it is. So now let's talk about that. I mean, now you deal with a lot. I mean, you deal with the patients, you deal with the parents, with the emotions, you deal with the system, you deal with the pressures. I mean, all of this, as you said, is like eventually you fry. I mean, if this was a circuit of anything, you
Yes.
will just literally have a short circuit, right? So it's like that's what it is. We get short circuited and fry our brains out. Let's talk about that. Like some of the triggers that actually that have led to burnout in the healthcare and in the
Hmm.
profession, and also some of the things that maybe we can notice in between and how we can prevent them.
Yeah. Oof, it's a big question. I'll try to tackle it.
You can
And I
handle it.
think that this element of humanity is really central to the way that I think about burnout in the healthcare system, and that the humanity has left. And I think everybody would say that on both sides. You as a patient, family member, say, "Wow, these providers seem like they don't even care. They're like inhumane." And the providers say, "I feel like I'm a robot," or "I feel like I'm just a cog in a wheel." And like everybody feels like they've been dehumanized in this system. So I think bringing some humanity back is the way forward. Fundamentally, burnout, and there are specific definitions about what we mean when we say burnout, but at its core, it's emotional exhaustion, cynicism, and a lack of meaning or purpose in your work. And so I think we see that in almost everybody. Like the discussion in medicine about burnout and physicians and nurses is kind of like, well, the definition doesn't work because it would apply to everybody. And I'm like, well, no, that just means it doesn't mean the definition's bad. It just means that we all are in this state because the conditions are so poor. So the biggest thing that I always emphasize is that burnout is not a personal failure. It does not mean that you can't hack it or that you're weak or anything like that. It really just means, as I think we painted the picture of here, it's a really unfair expectation for what a person could do. There's no built-in system of like rest and regeneration. It's just like go, 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 go some more, go some more. There's never like take a rest, take a break, restore yourself, put your emotions back together or anything like that. And so, of course, people are going to get burned out and fried. The thing about doctors, though, is we love to work. And for the most part, we love what we do. So I think everybody looks at the hours that we work and the amount of time that we spend at the bedside or the amount of time people spend in the operating room and say, that's the problem. You just need less time there. And that's not really the problem. I know surgeons that will happily do 18-hour surgery. That's not where the problem is. The problem's kind of with all the other stuff. And so, this is a sort of a coaching skill that there's circumstance and then there's kind of internal experience. And a lot of the circumstance we may not be able to change. The insurance industry, the hospital industry, the expectations we have about health and keeping people alive and use of technology, that train is going. Like that's going to really be hard to change, but we need to renegotiate our relationship with the work. I think you mentioned, someone that says, oh, like I didn't think this was what this job was about or something like that.
Well,
You're
yeah.
right. Now it's about something different. Maybe you were thinking about a practice of medicine, quite frankly, that didn't exist in my lifetime. But if we watch, Marcus Welby from the 50s or something, where people say, oh, that's what I wanted to be, the country doctor. Well, that just
Stops
doesn't
by the visiting
exist.
doctor. Yeah. Well, they do
We
have
have to
them.
kind of we have to renegotiate our expectations so that we're not constantly disappointed. That doesn't mean that's very different than like you personally are failing, but I do think that there's room for kind of renegotiation. And then, yes, of course, we should advocate for a better system. I just recognize that the scope of the US healthcare system is not something that's changing rapidly.
Well, it's not. Well, I mean, it's funny you said that because you're right. Like you watch these old movies, and I mean, even like until recent. I mean, in some parts of the world, I mean, they still have that old-fashioned medicine where the doctor comes to
Yes,
your home, you call them, they visit. I mean, we have visiting doctors in the States. I mean, but that's a minor. Now with telehealth, and some of the systems out there, it's making it a little easier. But at the end of the day, as you said, it's like it's the whole system, and it starts from education. I think from the education system, you're being trained as it's almost like military stuff, right? You go to boot camp and then you finish your boot camp and you get deployed to war. I mean, it's like that's all there is. There's
yep,
no respite in between, and so you're like constantly going. I mean, I to be honest with you, like I was with my mom in the hospital for a couple of days, and nurses are working 12-hour shifts. Now I know they
Mhm.
get 3 days off, but 12 hours shifts nonstop. I mean, it's just like I mean, she
Long.
was there 10 days, and I've seen some of these nurses that 5 or 6 days of that time frame, and they're working 12 hours is a long run, and they're not sitting. They're between this room to the other room, run here, run there, do this, do that. It's a lot, and the doctors in between. I mean, some of them, the attending doctors are there. I mean, it's a very horrible scene if you want to call it that way, and you can feel like people eventually. I mean, listen, everybody that's watching and listening, if you work somewhere, you get tired if you put too many hours, at work, right? And and by the way, at a certain point, you might not focus anymore. I mean, we are also
That's right.
our bodies have to reset. We have a sleep, time, and that's the other thing. These people work different shifts. I mean, there's nothing that beats sleeping at night, for example, right? And so,
That's right.
so if you have night shifts, I mean, you're not going to be as good as someone who actually works the day shift, for example. So these are just some basic things that we can think about, of. But really, it's amazing that I mean, you obviously make it work because you love it, as you said, it's passion, something that you enjoy, and you volunteer for this. But there has to be something. Maybe maybe there are ways that we can change this from the system up front. Maybe use technology. I mean, obviously we do use technology. There's more technology today than before. I mean, things are a little faster. You can get results faster, so on and so forth. You
Right.
can move things along. But you're right. But there's also capacity. How many patients can possibly a doctor see? And that's the other thing. Now we're talking about quality of care, and in general, I mean, we're having doctors seeing, especially in the outpatient, world space, and just general medicine. I mean, you're talking about 15 minutes, 10 minutes to see someone. I mean, that's not going to be. I mean, obviously, in your work, it's different because you get a case, you work with them, they become your patient. It's a long run, and you work with them, you get to know them. But that's not the case overall. So as you're dealing with healthcare workers and healthcare specialists and professionals, you actually deal with different types of them, right? And so some of them have different levels of stress based on the work that they do, and I guess the specialty and where they operate. And that's a big deal. And you're right, the system is just not going to happen. It's already sailing. It's a ship that sailed, and it's like you're fixing the ship as it goes, or a plane in the air, and that's a tough one. And you can do whatever you want. It's either be in it or be out, right? So, and since you're in it already, you got to kind of make the best out of it. And it's not now in your work, you do have some good guidance, some good strategies, some stuff. What can we, tell? Well, how do you deal with some of this? Or maybe some of the strategies you use, and then we want to touch also on your book and how people can work with you.
Thank you. One of the biggest things I think we can start with is to start naming the things that aren't actually productive or healthy for the individuals or for the system. So you mentioned night shifts. That's a beautiful example I'll just use to illustrate what I'm talking about. We just normalize night shift, and people say, oh my gosh, I have nights, I'm so tired, or people laugh it off. But the truth is that sleep deprivation and fractured sleep is a significant health risk. There's risks when you're driving home. We know that sleep deprivation makes you as impaired as alcohol in many cases. Over time, those people, night shift workers have much higher rates of chronic illness. So this is a significant health risk. And by failing to acknowledge it, because we don't have any other choice, right? I understand this. You also understand this. The hospital's open 24 hours. Somebody has to work at nighttime. This is just the reality. But I think the problem is that because we kind of get boxed in with, we don't have a choice to not have night shift, we have to pretend like there's no problem with night shift. Whereas I would like for us to say there is a problem with night shift. And so then what can we do to help mitigate that or restore people in a different way if they are working at night? Some people do choose to work at night, but it doesn't matter. Even if you choose it, either for the differential pay or just because you're a night owl, it's still having these downstream effects. And I think we as a system owe it to those people to help them take care of themselves. And this is true outside of the healthcare system too. I don't mean to say night workers in healthcare are different than people who have to work at night anywhere else. So that's just a simple example of how I think naming the problem, even though we may not have an easy solution, is important, and just not having this discordance of like, it's not really a big deal, it's fine. Same with, the 12-hour shift. That's another great example. 12-hour shift is not really optimal. It came about because that was a way to staff people so that they could get days off, and maybe it felt like a better work-life balance, and people like having, more days off in between, but really working that many hours at that intensity is not optimal. So we need to just name that, right? We need to stop pretending that it's okay. We need to stop pretending that not eating or drinking for your entire shift is normal or like a badge of honor, like, woo, I didn't drink for 12 hours, go me. We need to stop. I mean, all the time I hear it. You laugh, but
Oh,
it's like
I see it. I mean, you're right.
very normal,
Well, you
normalized.
get people get literally like points, and stuff like that. Hey, this is like, a trooper.
Right. And then the sort of the reward for not being emotional or punishment for being emotional, which I would just say is being a human, right? Humans have emotions. Obviously, we need to manage them and not be overtaken by them. And you don't need to be crying more than your patient. But this myth that we can't have emotions as physicians, we need to be like the robot who doesn't, can just make the decisions. That's a really harmful cultural attitude. I think that could, if we could overturn that, we could go a long way to improving the culture. And then I think acknowledging the amount of uncertainty that's there. This is going to be really uncomfortable for everybody involved. Doctors don't like to admit they don't know. Doctors don't want to admit they need help. We're trained that way because you're a good doctor if you know all the things and you know the right decision to make. We talked about shared decision making, and that's an important piece. But the truth is that most patients want their doctor to know what the right answer is. And if their doctor really came in and said, I'm sorry, I really have no idea what to do, they'd be like, oh my God,
What kind of doctor are you?
what kind of doctor are you? Did you graduate from medical school? And so I don't know exactly how to wade into those waters delicately, But that with the complexity of the system, more people saying, I don't really know, or I realize that none of us can know, is the truth. Right now, you don't know, and you should, because good people would. That's the lie. The truth is, this situation is so complex, no one could possibly know the right answer. So we're going to hold that together, which brings us back to that humanity piece, right? That's really kind of the whole human condition in a nutshell.
Well, that's
Nobody knows what we're doing. We're all just on this rock for some indeterminate amount of time, and then we're all going to
but
die.
I love your attitude. I mean, it's I'm enjoying you here, but really, you're bringing a different flavor to the world of doctors and medicine professionals. And by the way, I think what you're talking about can touch any other profession because it's exactly right. And it's funny because your profession and the healthcare system, it is not something you do like and you change mid career in the path. I mean, 99% doctors they're doctors for life until they retire. Nurses the same. So it's not like so it's consistency and it's a long term commitment. So you can't burn out. Especially and if you work the 12 hours, the nights over time, you're not going to be
Yes,
good. You're probably going to drop dead or get health conditions yourself. That's not going to be. I mean, it's like
yes,
that mask thing on the airplane, right? If you're not optimum, you're not going to help anyone else. So it's that problem. And
100%.
and I love what you said. Is like I think there's another factor that affects this, which is again, let's talk real. I mean, there's regulations. You're in the healthcare system. There's all these agencies, regulatory that are all over the place, looking at every little thing. And so you're always afraid that then the administration or administrators are always afraid of things. So there's too much pressure going on. Listen, I've worked in the corporate space myself, as I said, and I've been in positions with real decision making is happening, and so there's a lot of fear factor of all these regulatory bodies, and then you have the legal aspect of people taking advantage of the system. There's a lawsuit going on. I'm just waiting for the wrong thing so I can do my thing, right? And so there's
Oh,
all of
yes.
that. So malpractice is big. So it's created a space where doctors may be more reluctant of saying something because the doctor said that and I
Hmm.
mean, look now with the phones and stuff, people can record everybody at any time, and it's becoming a
True.
problem. So there's a lot of factors that actually are almost inhibiting doctors to be in exactly say that human and kind of like just be open. I mean, I don't think any doctor in the practice today that works, especially in the system, they're going to. Well, listen, I'm going to tell you the truth, 100%. Because if they said it's going to come back to haunt them if that something goes wrong and that nobody's going to take that chance because now it's their livelihood. That's the other thing. So there's that. Like everything is hinging on the livelihood, the finances too. Like your
Of
license can
course.
be in jeopardy. You lose your license, you're done. I mean, so there's some selfish reason why sometimes doctors may not be as frank and open and always be cautious because they will never give you like 100% certainty. Like nobody's gonna say like we guarantee. There's no guarantee in medicine anymore because you can't guarantee. Oh, by the way, I don't think it's ever
I don't
been
think
there.
there really should have ever been.
Yeah, I don't think it's been. But the idea is that you expect like someone to be as honest. Listen, your condition is this. We can do the best we can. But people are not going to tell you 100% that because they're afraid that if they say the wrong word, it's going to be misconstrued and then used against them.
Yes.
And now, oh my God, and we've seen this. I mean, it's not common to hear about lawsuits and things like that. Now, I'm not talking about malpractice for real when someone leaves in surgery as as an item
Yes.
in the body. I mean, that's different. But I'm talking about misdiagnosis or just saying something. I mean, no, I guess you said we're human, right? There is no 100%. I mean, there's a lot of work you do, and you're right. Every case is different. You do your best based on the knowledge you have. You keep updated 100%. And by the way, some doctors are better than others in terms of updates and keeping up with the information, the tech, and everything. And I'm not judging, but I can see that happening. Not everybody is equal, right? I mean, we have discussions on nutrition, for example, and I've had so many specialists in the nutrition space and diet, and they kind of claim that it's not part of the curriculum in the medicine, or at least not heavy, and therefore a lot of doctors may not. They don't ask you like what is your nutrition intake, what do you do, what's your lifestyle in the food. That's not something that's it should be, but it's not. So these are things that are actually there's things that are missing in the picture, and the expectation from a patient is that you are know it all. You're like
Yeah.
Wikipedia, Google, and ChatGPT mixed
Hmm.
in, right? But that's
Right.
not the case. So thank you for sharing those at least
The tough spot,
bring
isn't it? Sounds like a
Well,
great job. I can just see people are just come thronging to medicine these days. This is really a fantastic profession we've set up here.
it is. Listen, it is. I mean, it's a beautiful profession, and I think the system is what's creating these feelings, or at
Yes.
least this resistance, or these. I mean, you have to be brave to be in it, and you got to deal with it. And obviously, in time, you become, I guess, immune to all these pressures and stuff to a degree. But there's no immune because people do burn out, and that's what you tackle. No matter how strong you think you're tough, your tough skin gets a little weak, and then you get hurt. And so now let's assume like someone you work with someone and they really are there. What's their recourse? How can they actually go around it? I mean, they can't just take off for a couple of months and just disappear from the surface. What are some of the things that you might suggest to people that may be listening right now in the profession?
Yeah, I it's challenging to find the space to actually heal because for all the reasons that we've highlighted. One reason why physicians keep showing up is because we do love our job and we do believe in the mission. And we know that if we're not there, there probably isn't going to be somebody to fill our spot because we have a physician shortage already and we're on track to have an even greater physician shortage. So there's really that pull to not take the time that you need to heal. If anybody told me I'm severely burned out, what should I do? I would absolutely say take 3 months off. Like that would be the thing that I would recommend because your brain and your body and your nervous system just needs time to unwind and to thaw. And it doesn't happen in a weekend. If you got into this over 20, 25 years, one short vacation is not going to undo it. We do need a longer break. And then during that break, we need to do some very intentional things to kind of reprogram and renegotiate our relationship with this work so that it doesn't wound us as much as we have let it. The system is brutal, and we need to have a little bit better armor, not turning us into robots, but human armor of knowing how to let things flow, right? A stimulus of stress comes in and we trust that we know how to move it out. And so there's this flow of stress and recovery. This is very natural. Our bodies know how to do it. We just override it with pretending that we don't need to do that. So that's a lot of the stuff that I teach. That's the stuff that I cover in the book, about kind of reclaiming these regenerative practices so that you can stay in the work. Because I don't want people to quit. I do think that people need a break. And helping people figure out a way to actually take a break is part of what I do. It's not easy, but it's possible. There are such things as sabbaticals. There is FMLA leave. There are ways that we can get you a break if we can think creatively. The other thing that I often try to empower physicians, so many people come to me and say, well, if I'm not a doctor anymore, I have no skills. I mean, there's this whole identity piece that we have to work on. If I'm not a doctor anymore, I don't even know who I am because that's been my core identity since I was 16 years old. That aside, they believe they have no marketable skills. Does that just sound like the most ridiculous thing to you that a physician who's been through everything we've been through thinks they're fit for nothing? They might as well just go. Trader Joe's is their number one jobs prospect. I'll just go bag groceries at Trader Joe's. I'm well, if that's what you want to do, you do you. But you have a lot more skills, and we could probably come up with some really engaging and impactful activity. And there are tons of physicians who are moving into non-clinical careers in tech and in writing and in, all kinds of fields that we're leveraging our skills and our experience in different ways. And so I always encourage people to do that too. If it feels like staying in the clinical arena is really just too much, sometimes you need years of break from the bedside to restore. And so that means you got to go do something else because most of us don't just have the option to just not work for years. Again, if you got that option, please take it.
Well, thank you, Doc. But you're right. I mean, by the way, I love what you said. I mean, you're a doctor. You're smart. I mean, by the way, I'm not just gaslighting here. I mean, it's not easy to actually go to school and and capture all that information and stuff. and some many are business people as well. In addition to that, and they some have side degrees and diplomas and things like that on the side. So there's a lot of stuff. As you read, then you could be a writer, you can be you can start teaching, you can go overseas and teach others. I mean, there's a lot of ways you can do this. I mean, we have shows now, we have TV, we have a lot of things that can be done where you can still be you, but at your own pace with less, and you can still make it lucrative. So there's ways, but certainly, but that will just add to the shortage that you stated earlier. And by the way, I do
Right.
have a question that just maybe weird, but I don't know if it's me, but I feel that as we're into the new generation, they're not as active in the workspace the way I think previous generations are. Maybe it's just something that I'm hearing or seeing as a trend, but I think they're less like so I can speak about my kids. They're not really as aggressive in terms of career paths as you know my older son or even my generation, right? And so that's shifting. Do you think that will make it worse for us in a lot of areas where people may not? I mean, they may be used to more like tech and remote stuff, and they're not really as engaging. They're more social on the social media than social in live, and therefore it's difficult. And I'm not judging, but I think maybe in this case we'll have a higher percentage of lesser people willing to go into a profession that has this kind of track, and so therefore we'll have a lot more problems. And now that leads me to the other question. This whole shortage, I think it's happening because I think in the US, for example, we do not accept doctors from any part of the world because
Mhm.
of we want them to go to our system. Yet there are doctors that can do just as good and they're just as qualified.
Sure.
And actually, if you go to medicine, what do you call it? Without Limits, Doctors Without Limits,
Doctors Without Borders. Mhm.
without border, there you go. So, Médecins Sans Frontières. That's what I want to say. But so these groups, I mean, they're doctors from all over the world. They all kind of chip in and work together as a unit in these missions,
Yeah.
right? And so doctors are qualified all over the world, but yet we are unable to accept any others. I mean, we do accept nurses, to come in. For example, there's a huge import of nursing, right? Staffing, but they still have to get the license. But it's easier for a nurse, for example, to come in and get here than the doctor. I mean, that's the thing. Is it the ecosystem that is in the medicine, practice, or is it just really the system that just they don't want? And I think they'd have to change their mind. It's archaic to a point, and maybe we have to open that we're not the only ones that have the best medicine in this world. Because I mean, other countries are thriving, and sometimes they're ahead of us. And it's just it's open discussion, but you know this better than anyone else.
Oh my gosh, there's so much in that. The thing I will say about the younger generations, I do think that they are learning more of the downsides of our traditional American culture, which I would say is like a hustle culture, achievement mentality. More is better. Do more, achieve more, make more money. And that they're kind of saying, we're not sure we'll buy that line, which is showing up in all the kind of ways that you mentioned. And so I do see that. I don't know that I think it's bad. I think it's different and it's mismatched to our current systems,
Exactly. Yeah.
especially in medicine, but in every industry, right? And so I think, I don't know, I watched that with curiosity. One of the questions that I have is what about our current systems is necessary and what about our current systems is just there because that's the way we've already done it. And so being able to kind of courageously be curious and maybe scrap some things that are so-called sacred, like specific things. This foreign medical graduates is one of those things that maybe has to get toppled, right? Maybe we have to say that that rule was made based on some past set of data, and now we have a different set of data. I'm not going to say whether it was bad or good, right? But it just was behind us, and now we're going to make a different decision. This is the compassionate way to approach yourself as well when you're looking and saying, why did I make that weird decision in the past? Just say, well, that was in the past. We don't even have to like get all shameful about it. So, anyway, so I do think though we need a new system moving forward. And all of these things are kind of like little seeds or little nuggets of what might shape the future system. And so I'm very curious to watch it. I certainly don't have the answers to how any of these things will turn out, but I think that just continuing to do it the way that we've always done it is obviously not going to work. And that it is ego, it is kind of American cultural values in the way that we sort of name what work is and glorify productivity above all else. And that I think we can learn from looking around the world to different cultures that may have different value systems to learn a lot from them, which again, keeping that humility, keeping that curiosity and saying, what can we learn from other people versus saying like, no, we're America, we do it the best. Shut up, we don't even care.
Yeah, but thank you. I mean, you're being open
Not
about
to,
this.
I mean, again, that's not political. Like that just is a fact about the way
No,
that
no,
America came to be a country.
no, no, you're right. Listen, I mean, uh, America is still America, but there's a lot of, we're not the same that we were 10 years, 20, 30 years ago. I mean, we're supposed to be better, but I think we've missed a few steps here and there, and other people caught up to us and even exceed us in areas. And frankly, I mean, there are people that are like there's an exodus, of talent sometimes from here to other places now in the world because you can practice somewhere else in the world easily. You're an American doctor, come on in. We'll give you all the support. Open a clinic here
Oh,
in this.
Canada's throwing open an open invitation. Like, come on up. Anybody who wants
Well,
to.
well. Right now we have a little bit of a clash. The Titans is with our neighbor. So and by the way, I work with Canadian doctors all the time. And the healthcare systems are completely different, and there's political views that are different now. With the politics got worse, and but you're right. I mean, but the idea is that there is, to your point, for a solution. As long as doctor is open or professional is open to other opportunities, the world is really a small village now. I mean, it used to be limited. Now you can't. I mean, there's no real borders. I mean, talking about medicine, so much,
Yeah,
doctors without borders. There are no borders really now. I mean, you on telemedicine is practiced now everywhere. People
that's
can practice.
true.
But here's the thing. For example, within the states, you are certified in New York, for example. You might not be able to operate in Florida or another state. Just I'm talking about within the 50 states, we have problems. So let alone doing, and getting people from here. And again, it's an archaic system. It was created as a club, I guess, of like, let's make it work, and make it
Yeah,
special. But I think sometimes you got to just move those walls and get out, like thinking, we see the word think out of the box. Well, I think we got to think out of the box on this one, and hopefully we can make
for
changes.
sure.
But
Totally
again,
agree.
you and I may not be able to change that today, but at least talking about it can open the ears of and the eyes of somebody, someone out there. Maybe
Yeah.
there's we have to be innovative. I mean, we have to evolve, right? I mean, our motto is time to evolve. So let's evolve, folks. And hopefully find better ways. Now, the book
I
that
love
you
that.
have, what's the name of the book?
The book is called The Phoenix Mindset Emerging Stronger from a Healthcare System Ablaze.
Ooh,
Totally just goes right to everything we've been talking about that we need to kind of rise from the ashes. We can't recreate or we can't go back, right? We can only go forward. And if the healthcare system today is truly a dumpster fire out of control, which many people think that it is, we need to find a way to come out of that fire stronger, both as individuals and as a system. The book is a combination of my memoir going through burnout and some of the cases that were particularly challenging for me, as well as a roadmap out and the things that I did from the depths to get myself out of the depths of burnout to the state of practice that I have now, where I love practicing medicine and have a job that allows for me to have that flow. There was a intentional process that I'll say I found. I like, you know, feeling around in the dark, found my way to some good things. But then once you figure something out, then you want to like turn around and show all the people behind you how to do it. So that's what this book is about for anybody in healthcare who's feeling burned out and wants a hand to kind of show them the way out of the darkness so that they can kind of reclaim their phoenix power and dance in the fire. Because I do need people to still go back in. We can't all quit and just go work at Trader Joe's. We have to embrace this reality that like we're walking into a fire every day and but know that we know how to do it.
I think your book concept should be not only taught in academia. I think it should also be given to healthcare administrators in these hospital systems. Maybe they can have some
Yeah.
guidance. I mean, right? I mean, it's a roadmap to how to do it better, and based on real scenarios, your personal experience. And again, that's that. I love this. I've said this many times about authors and books. And I mean, you guys are creating a legacy and tools for other people based on real facts, real stuff. Now we're not talking about fictitious books here. We're talking about real practical books that are like for training purposes, coaching, guiding, things like that. So this makes a big difference. I mean, even a discussion like this can make a difference in somebody's life. And I think one thing we didn't talk about. I mean, we talked about the burnout in general, but there's a mental toll. I mean, that is beyond just the physical aspect of things. And I think that's. I mean, if you get mentally off, it's over. I mean, that's the other thing. And some people can.
Yes.
I mean, we haven't talked about the risk of maybe people getting into like not drugs, but like let's say taking extra medicines to keep sharp or whatever, and maybe get an even Tylenol. You get a headache, you pop a couple of acetaminophen in your body. That's not cool. I mean, eventually it's going to destroy your kidneys. I mean, you're a doctor, you know the risks. But I'm just saying. I mean, there could be a lot of things, and I'm not saying that's happening, but I can think about it that way. I mean, we all are
Yes.
human.
I use the basket term just to keep us all safe, negative coping strategies. So that could be everything from a pint of Ben and Jerry's to drown your sorrows to, use of alcohol, narcotics, or other drugs. And obviously, as physicians, it's very dangerous for us to admit that we have problems because the medical boards are very strict. And so that actually does keep people from seeking help if they feel like they're getting into a self-injurious situation. This is a whole nut. We could spend another hour on that problem alone. But this negative coping is a significant risk of the chronic stress, and that becomes a problem into itself. So thank you for mentioning that. It definitely is, and something that if I can, reach behind and pull somebody up and say, let me show you the light. You don't have to turn to those negative coping strategies. That's going to be a real success story. And then, of course, get people brightened up, get people into that good mind state, good brain state, so that they can come up with good solutions. I mean, you and me can't come up with all the solutions by ourselves. We need a whole army of smart people. So I got to turn a whole bunch of people around
And
before
you're
we
doing
have
it.
the smartest people to be able to fix this problem.
Well, doctor, you're doing it. I mean, through your work, through your book, through your going out and to shows and really sharing the values here. Because I think the more the word is out there, the more you're going to find following into this idea. And I think everybody, I mean, people are not stupid. I mean, I think everyone out there knows when it's enough, when something is not working. I mean, listen, I mean, when we're about the hour here, but we just got through the pandemic a couple of years back, and that was another level of very overwhelming in the healthcare
So much.
system. That burned out a lot of people, and some never recuperated. I mean, some people just quit and they never got back into it. I
That's
mean,
right.
it is a tough, and God knows what's in store for us in the future, right? I mean, so we have to be prepared, and the only way to do that is to, as you said, to have these coping systems in place, and people are being prepared like everything else. I mean, we always talk about being prepared in business and in anything, right? This is another way you have to be prepared. That how are you going to handle the next thing? Not even sure how, but you're right. We're not going to solve that today, but at least you're igniting a little fire for people out there to actually kind of see the light and then get that. Oh, what is that? There's a flame out there. There's a little beam of light that's coming out. Let's see and see what happens. So doctor, now how can people work with you, and how can they reach out to you, and what does your program look like?
Thank you. The easiest way to find me and get the most up to date on any programs that I have is just to head over to my website, which is emmajonesmd.com. We have links to where you can buy the book. We have links to our current group programs, which are for physicians and other prescribers. And then as we offer different things over the course of the year. We may be doing a book club again. We did a book club last fall where we kind of had a free group coaching program. So anything like that may come up, we're always going to post it right there on our main website. So that's the best place for everybody to go look and see what we got going on.
People can sign up with you in any particular program that you can work with them sessions. Is it individually? Is it group? Is it like a telemedicine kind of concept where it's remote, like people can do it? How does that work?
Yes, my main group coaching program is called Unstuck for healthcare professionals. We want to get them out of that stuck in the mud feeling. And that is a 6-week group coaching program done over Zoom. So we use the technology, right? And it's amazing how much humanity we can convey over these bits and boops if we do it right. It's the intention, not the modality. So I've loved doing that program. It's called Unstuck, and that will be enrolling soon for physicians and other healthcare professionals.
All right. Well, doctor, we're just, a little over our hour. Any last words of wisdom you want to keep our, professional audiences out there, but also just general public in general?
Main word of wisdom I have is to not hesitate to ask for help. You're listening to this podcast, that's already a step in the right direction towards improving yourself or opening your mind. You don't have to know even what kind of question you have. Just say, somebody, this is all. I mean, that is such a revolutionary act. I just want to celebrate it in advance that everyone listening is going to just say, I need help with something, because community, acknowledging our humanity, this is the way out of this. And specifically for healthcare workers, if you're struggling, put a hand up to me, go to the website, join the newsletter, join the program, send me an email, whatever it is, just to say, hey, I don't even know what I want from you, but like, I'm here. I would love that. And I think that that's such a good first step because it's actually so hard.
All right. Well, that's powerful. There, and you're right. I mean, people just have to ask. I mean, it's the biggest thing. People usually don't want to say I need help because they think they can figure out, they can ride the
Exactly.
wave. We are not invincible people. We have our own weaknesses and limitations. So as long as we're agreeing to that, I think we're good. And yes, do raise your hand. Do check out, Dr. Emma Jones's website and connect with her and see how, she can help you elevate and hopefully, kind of be better, operate better, and be more productive. I mean, that way you can do more good in this world that you've, I guess, set yourself to be doing, right? All right. Well, that's it. Doctor, thank you so much for being with us today. It's been a real honor and pleasure.
With me.
All right. Well, that's it, folks. This is a wrap for today. I'm Hurricane H. We'll be talking soon with a new show on topic. Bye for now.